COVID-19 infections in France, Spain, Italy and Germany are spiking again, and the World Health Organization has warned of a resurgence of the virus in Europe. It says the rise in cases is due in part to the relaxation of public health and social measures, and that people have been dropping their guard. Health Minister Dr. Zweli Mkhize has been at pains to warn South Africans not to become complacent. So, what needs to be done to prevent a second wave of COVID-19 infections, or must we simply prepare for it? Professor Adrian Puren, head of the Center for HIV and STIs at the National Institute for Communicable Diseases, joins us now to have that conversation. Prof. Adrian, good evening and thank you so much for your time tonight. South Africa's coronavirus data, which I've just gone through, shows a continued downward trend. Would you say we have seen the worst of the pandemic, or is the worst still to come, particularly looking at how the Spanish flu behaved and how the second wave of the Spanish flu was actually worse than the first wave?
Yeah, so some of these things are really difficult to predict, and I think that we need to look at the experiences of other countries and how they're managing the resurgence. I think we had the blunt tools. I think one of your listeners mentioned about the fact that we closed down, and we can debate about whether that was early or not. I think it was a good move, in fact, to have that first part, that blunt instrument, the level 5, for example. But we realized that it was going to be very difficult for us to actually sustain that particular level of physically containing our societies. And again, many of our communities have and still do find it very difficult to implement the so-called non-pharmaceutical interventions. That includes the physical distancing, the wearing of masks, and the hand hygiene. So we have monitored the effect of those particular events in part by looking at what is called the effect of R value, the reproductive value. And we do see that, in fact, as we step down, in fact, from level 5 to level 4 to level 3, that in fact the infection rate has certainly decreased. And we certainly attribute, I think, some of these particular decreases to the fact that, in fact, we have been able to, and the communities have been able to some level, actually have adhere to some of the aspects that are required. Because those are the only aspects or objectives or tools that we have at hand are these non-pharmaceutical interventions.
Yeah. Now, some experts are saying, Prof, that a second wave of COVID-19 is a statistical certainty and something that we should be bracing ourselves for. How different will this second wave be compared to the first wave?
Yeah, so having painted that scenario, I think what is now critical is, in fact, that we continue to communicate those key messages to everyone. That, in fact, the so-called physical distancing, the wearing of masks, the hand hygiene, and now the additional ventilation, because we think that it's also by aerosol spread, these are still the key messages. So even though, yes, I agree with you that we will likely see surges occurring, they should not occur to the same extent as we've seen in the first period of reaching the peak. And my sense is that if we are able to try and control those particular aspects, we may not see the vast increases in numbers that we've already experienced.
When will it happen, Prof?
I think that's going to be very difficult. I think it depends on the movements and interactions where, for example, we have closer contact, lesser degrees of adherence. Then I think we can start seeing it. But I think to try and predict it, I think it's going to be very difficult to do. Perhaps in the next few weeks, we may certainly see that. We may see clusters, for example, or outbreaks in homes. And that's why I come back to the fact that I think we need to make sure that where we think that there are likely to be, for example, clusters or outbreaks, that we actually shield those particular communities. And for example, the example would be, for example, old age homes, for example, which are at high risk, or individuals who have a high risk of infection, such as those on the older age groups with comorbidities. Those are the people that we need to try and protect as well. And it's also important to still give those messages to people, because as you've mentioned, a large proportion of people have actually recovered. They've recovered well in the main.
Yeah.
And those are the people that we still need to aim our messages to, that you still need to have the physical distancing, the hand hygiene, and the masks in order for us not to experience massive surges.
Because we have handled the pandemic and the outbreak as well as we have done in South Africa, that number of recoveries, 520,000, many are saying, well, this would represent very little resistance in our community. And therefore, we still have a large number, I mean, if you look at the population of South Africa, of people who did not contract the virus and therefore have not built that level of immunity.
Yes, and that's the whole point, isn't it, really, that I think we're over 1% of our South African population have actually been infected. We still don't have a vaccine. We still do not have medications to prevent transmission, for example. So you're quite right. There's a large proportion. We still don't understand the full dynamics of this particular virus. We're referring, I suppose, you and I are discussing what is called herd immunity.
That's right.
So for herd immunity to occur, the initial estimates were around, say, 60 to 70%, for example. But there have been some additional models that show that, for example, people may well be resistant or protected because they've been exposed to other coronaviruses. So the herd immunity may not be as high as that. It may be less. In fact, some models even go down to 10 or 20%. So I think we just need to be aware that there are these ranges, and you're quite right. There's still a fair proportion of people that are still susceptible to becoming infected.
Will restrictions be necessary in a second wave? I mean, government, of course, has learned some tough lessons around the impact of lockdowns on the economy, on the livelihoods of people and employment, particularly South Africa, where unemployment was already quite high.
Yes, so I think it's going to be very difficult to try and reverse that. But if, for example, we do find that our guard has really come down, there may be instances or areas. They don't speak anymore about clusters, for example, or hot spots, for example. But I think one would have to take certain measures possibly into account to try and reverse or prevent further transmissions as far as is possible. So, for example, I mean, we still do not have spectator sports, for example. We still need to adhere in terms of funerals, restaurants, and so all those places still need to adhere to those events in order to prevent what we call super spreader events. In other words, you just need an event where one individual can spread to a multiple number of individuals to spread the disease, that you can have those clusters and outbreaks. And we've seen that happen in Europe, the UK, and in the United States, for example. We have these events that lead to large numbers becoming infected because they're still fairly vulnerable. And what has happened in some cases, and we've seen this in the UK and to an extent in Europe as well, is in fact that they've actually gone back. They've reversed some of their decisions in order to try and stem the transmissions that are occurring.